Hello, I'm Jonathan Mast. Welcome back to the Wellness Zenter, and thanks for being part of the Sedgwick Virtual RIMS Week. Our guest for this session is Andrea Buhl, Managing Director for Managed Care for Sedgwick. And your topic today is eating right and exercise, something that all of us are always curious about. So I'll turn it over to you, Andrea.
Thanks, Jonathan. You know, when it comes to our health, sometimes the smallest things are the things that really can have the greatest impact. And to illustrate this, I want to share an experience I had. When I was studying to become a nurse practitioner at Duke University, I was in my third semester and I was working at the Duke High-Risk Obstetrics Clinic. Now, at this clinic, we saw a variety of women throughout their pregnancy that had different comorbidities or health situations going on, anything from HIV in pregnancy to gestational diabetes and everything in between. Well, one of my first days, I was assigned to go in and assess a woman who was of advanced maternal age, and she had some other health things going on. And I went in to do the assessment. She had been in several times prior, and typically at this stage in her pregnancy, we would just take a look at her labs, her basic vital signs, and ask her how things were going and maybe do a quick abdominal exam. But so as I started talking to her and asking her how things were going, you know, she mentioned to me that she was pretty tired, which normally isn't that big of a deal. It's pretty much to be expected in pregnancy. But as I talked to her, I felt like I really needed to do a little bit more in-depth of a physical assessment on her. So I asked her if it'd be okay if I palpated her thyroid, and she said, sure. So I felt around her neck and I felt this little pea-sized bump right on her thyroid. And I said, hey, how long have you had this here? And she said, you know, this is the first time I've been told I had it. I didn't even know I've been carrying this around with me. Now, a lot of times a thyroid nodule can mean nothing. It could be benign, but sometimes in rare instances, it can be cancerous, or it can also cause your endocrine system to go completely out of whack as it relates to your thyroid hormones, which can be a big deal in pregnancy. And so I took this finding back to the attending physician that I was working with, and she said, why did you think to check her thyroid? And I said, well, you know, she wasn't new to the clinic. This wasn't her first time coming in, but she was new to me. And so I wanted to make sure I was looking at her holistically. And she said, well, I'm glad you found that. Now we can take care of it. And as it turned out, it was an issue that would have impacted this woman's endocrine system. And so it needed to be managed. But it was a very small thing, and it was a very small act that I did to pick up on that so that we could have a really great outcome and she could have a healthy pregnancy. Now, as we talk today about diet and exercise, a lot of the stuff I'm going to tell you isn't big and grand, but they're small things that if you incorporate into your life, they can have a big outcome. So a lot of us realize that exercise has a tremendous number of benefits. Unfortunately, we don't all do it as regularly and as frequently as we should. But today I'm going to help you understand why it's important and some of the things that happen physiologically when we exercise and why it is that it's so important for us. So when we look at the benefits of exercise, there are several of them. It includes lowering your LDL cholesterol, your bad cholesterol, increasing your HDL, so your high density lipoproteins, those things that help keep your arteries clean. When you get your heart rate up, those types of cholesterols are affected. It can also help increase testosterone production, and it can help increase bone density, particularly important for women who are postmenopausal, because as we go through menopause, we stop producing estrogen, and estrogen has a really protective effect on our bones. So our bones become less strong after menopause. But if you do weight-bearing exercise and activity, you can increase your bone density. So that's going to help substantially. Exercise can also help increase your lean muscle mass, and that helps increase your metabolism. So it can keep us leaner. The more we exercise, it has a great effect that way. It can also help reduce stress. And the reason for that is because when we're stressed out, our bodies produce more cortisol. We have more cortisol sitting around in our bloodstream. As we exercise, it uses up that extra cortisol. So literally, it reduces your stress level. And it can also produce endorphins. We've all heard about endorphins. There are these amazing chemicals that are released as our body exercises. You've all heard of a runner's high, probably. You don't have to go run a marathon for your body to produce endorphins. You can get it after just a few minutes of exercise. And endorphins have been shown to actually impact our mood. And that's what I want to talk about next, is our mood. and how exercise impacts the changes in our brain. Now, particularly during this pandemic, as many of us are quarantined or isolated to our homes, I think many people have experienced an impact to their mood. Your whole routine is disrupted. It's hard not to feel a little bit down and to feel like, to have your mood be affected, particularly because most of us aren't going to the gym and all the gyms are closed. And so a lot of people have their exercise routines have changed. And right now it's where is probably the most critical time for us to continue to exercise because of the impact that can have to your mood. So when you increase your physical activity and you get your heart rate up, that blood flow goes up to your brain. And then there are changes that take place within your brain. So we see that with increased blood flow, we have increased connectivity in the brain. We also see that we have neurogenesis, so the development of new brain cells as that increased blood flow occurs. And actually, we can see new neural pathways being established and neuroplasticity occurs. So we're able to have, when you think about all these changes that are going on, and we look at scientifically what occurs, we see that the area of the brain that is responsible for memory and for mood, the hippocampus, is actually impacted when we exercise. So as they look at people who have depression as they age, or as we age, the hippocampus starts to become smaller, it starts to shrink. What exercise does is it protects the hippocampus from that degeneration process, from shrinking. And so that is why with routine exercise, we see that people have better memory and overall just better mood. Making exercise a really good strategy in treatment for depression. For people with mild or moderate depression, exercise can be a fabulous tool in reducing symptoms. And for people who have severe depression, even exercise can be a good part of their healthcare regimen in combination with pharmacotherapy or psychotherapy, or perhaps a combination of all three of those things. One of the difficult things, though, when you think about depression and exercise, a lot of times people who are feeling depressed don't feel like exercising, right? And it's hard to get up off the couch anyway, for most of us, let alone when we're not, feeling we're not in a very good place mentally. And so that's why it's really important for people to have, if you feel depressed or you know someone who you are concerned might be feeling depressed, it's important to have a social network of people that you can trust, that you can talk to openly and honestly, so that they can help along with that process. And so as we think of COVID-19 and we're all social distancing and we're not really in contact with our friends as much, it's a good time to check in and maybe encourage your friend to be your exercise buddy. Now, it doesn't necessarily mean you have to be working out on FaceTime together. You could, or you could just share your exercise routines with one another and maybe they can pick up some ideas. But that sharing and that talking to someone and sharing the information holds you accountable and helps them as well. So a great tip to think about as we're all dealing with this pandemic and trying to stay healthy. So what is the best way to exercise? There's a lot of information out there. There's a number of different things you can do. The World Health Organization recommends that you exercise for a total of 150 minutes per week and that it be moderate in intensity. So when you think about that, it doesn't mean you have to go to the gym and pump iron. It can be broken up into various times of the day. So if you want to get up before you go log into your computer and exercise for 10 minutes to get your heart rate up, then take a walk at lunchtime and do something similar in the evening for 10 minutes each, and you do that 5 times a day, then you'll meet that 150-minute requirement. It doesn't all have to be within the same amount of time. You don't have to, do it twice a day or even 5 times a day for 30 minutes. You can break it up. The key is to find something that works for you and to stick to it. So we've just talked about exercise. There are many of them. I want to move now into nutrition and why good nutrition is important, particularly again during this pandemic, because nutrition can also help affect your mood. Just like if you were going to race a high performance sports car, you'd want to make sure fuel into that car so that it could perform optimally. The same holds true for our bodies. If we're putting good fuel in, we're going to feel much better. And in fact, many of you have maybe heard the old adage, the way to a man's heart is through his stomach. Well, there's actually a lot of truth to that. Serotonin, which is a neurotransmitter that helps regulate sleep and appetite and even mood, and also incidentally can also help inhibit pain. Serotonin is an amazing neurotransmitter. It is, it's a chemical that is produced. 90% of it is actually produced in your GI tract. So it is in the lining of your intestinal tract. Your body is producing the serotonin in your gut, which is used to send signals about mood to your brain. And that's why it's really important that whatever you're putting into your stomach is going to help with that process. Now, what are the best foods for that? What are the things that you should be eating that are going to help facilitate good mood and good overall health? There's a lot of information again out there that you can go on the internet. You can find all kinds of recommendations, anything from keto diet, paleo diet, Mediterranean diet, all of these different things. But as we look at what the experts say, if you look back to the most recent American Heart Association conference, they do a scientific sessions conference where they bring in the top brains when it comes to diet, nutrition, and health, and they all discuss what is the best. And what came out of that conference is really that you need to be taking a look at things holistically and maintain a healthy dietary pattern. So these are foods and the types of foods that you eat on a regular basis and over a sustained period, and what goes into your body holistically. So if we look at some of the diets that I mentioned, including the Mediterranean diet, there are some studies out there that show if you look at the traditional Mediterranean and traditional Japanese diets as compared to the traditional Western diet that most of us Americans eat, the studies show that people who eat a traditional Mediterranean or Japanese diet have about 25 to 35% less incidence of depression in their life. And so you can see that, that's a significant amount, but a third less people have depression based on the types of, when all things are equalized, just based on the types of food they're eating. And the researchers concluded that the reason for this is because our Western diet tends to be very high in processed foods and refined sugars, and foods that don't help our digestion and don't help with that probiotic process that needs to occur, unlike we see in the Mediterranean diet or the traditional Japanese diet that are high in fruits and vegetables that help with that digestive process and that release of serotonin. So one thing to consider when you're trying to adopt a healthy lifestyle, healthy dietary pattern is, does your diet mainly consist of refined sugars and processed foods, or are you eating more fruits and vegetables and lean cuts of meat, perhaps like you would see in a Mediterranean or traditional Japanese diet? And unfortunately, this information isn't really is not focused on in the healthcare setting as much as it should. When we look at medical school curriculum, unfortunately, it's not taught. Like, there's no diet and nutrition that's a formal part of the curriculum in medical schools today. So it's really important that we educate ourselves and we educate the people we care about, so that we can ensure we understand what we should be putting into our bodies and what's going to help us have the best longevity and health. And also, when we do get sick, what's going to help us recover more quickly. When we look at the people that are going into the hospital, about 50% of people that are admitted to the hospital are malnourished. Now, a lot of that we can find the majority of that person, are people that are within middle age and lower that are going into the hospital and don't have the right nutrients on board to have a good outcome and help them recover quickly and fully. And so that's why it's important for us as we're, as if we know anyone that's going to be going in for surgery, as we look at people within our workers' compensation realm, employees that are going into surgery, it's important that people understand what they need to have in their diet so that they can have a good recovery. Some of the things that are important, for example, for wound healing, include vitamin D because it helps with collagen synthesis, which is required for wound closure, as is vitamin A. That vitamin A is responsible in part for epithelialization. So when you develop new skin cells that need to, cover the wound, you got to have vitamin A on board to do that. And zinc is another really important one because it helps with cell mitosis and cell proliferation. So essentially the development of new cells. And there are a lot of natural foods where we can find these. Most people think of orange juice when they think of vitamin C, but really you can find vitamin C in broccoli. It's a really good source of it, in red and yellow and green peppers and kale and tomatoes. And vitamin A, most people think of carrots, but I don't know that you'd think that black-eyed peas are a good source of vitamin A. They are, as is spinach. The other thing, as we're thinking about recovery, if you've had an orthopedic type of surgery or you're planning for one, it's important that you have enough vitamin D and calcium on board for that. Again, you can find these great source of vitamin D is egg yolks, which, 1 egg a day is actually pretty good for you. Used to be don't eat eggs because of the cholesterol. Now we know that most people produce their own cholesterol in their liver, and that 1 egg a day is fine. It's not going to, for most people, elevate any type of cholesterol. So lots of great foods. Calcium, something people don't think about. Most people think about milk when it comes to calcium, but figs are actually a good source, as are green leafy vegetables. Protein is another really important nutrient that we need to have on board if we're getting ready to have surgery or if we've been ill, because we lose a lot of muscle mass when we're lying around. Protein also, when you have a wound that's healing, you have stuff that leaks out. It's called exudates. That clear stuff that kind of comes out, in that is a lot of protein. So in order for us to recover fully, we're losing that. We need to replace that. And if we come in with a baseline that's below where it needs to be originally, anyway, it's going to take longer for our bodies to heal and to recover. And so protein is really important. We can get it outside of animal products. Lentils, chickpeas, tofu, eggs, again, nuts and quinoa are a great source of protein. And then one other thing that I want to talk about, because it's really important, is fiber. A lot of us have heard that you can eat fiber if you want to stay full longer. Fiber is in a lot of green vegetables. Raspberries are also a really good source of fiber, as are whole grains and beans. But when we've had a surgery, a lot of times people have anesthesia, which can stop the gut from working. That's why if you've ever been in the hospital and had the unfortunate experience of going through a surgery and being under anesthesia, they want to get you up and walking as quickly as possible so that they can get your gut working. You got to have water, you got to have fiber, and a lot of times they give you pain medicines that stop all that stuff and stop all of your digestion from moving along. So that's why it's so important to have fiber in your diet and to be in a good place before you undergo surgery, so that coming out of it, you can recover quickly. And finally, just one thing I want to talk about, because there's a lot of, you've, I'm sure, have read about antioxidants. And I just want to help you understand why they're important and maybe dispel some myths with them. So antioxidants are important because they fight off something called free radicals. Free radicals actually are naturally occurring in your body. They can occur in the environment as well, through pollution and smoking. But a lot of times our bodies do produce these anyways, and they actually have some protective effects to them. They are required for our immune system to fight off infection. The problem becomes when you produce too many of them. So maybe you're exposed to an environment where you get them in, maybe you stay out in the sun too long, you like to tan in the sun, that can increase the free radicals that are developing in your body. Alcohol can increase it. Like I mentioned, cigarette smoke, even high blood sugar. So if we eat too much sugar, it can increase the free radicals that are floating around in our body. And that becomes problematic because the free radicals then can cause this oxidative stress process that then can actually alter your DNA. And when that happens, that alteration of DNA occurs that speeds up the aging process. That's what some studies indicate anyway, but it also can cause certain types of cancer. And so the antioxidants actually help fight off the free radicals. So if you eat them in your diet, you should have a good amount that can help maintain that balance. If you're thinking about taking a supplement that has antioxidants in it, just be aware that you do need to have some of these free radicals in your system. They do play an important role. So that's why a lot of times just getting the antioxidants through your diet is a good option. So fortunately, we live in the United States where we have a lot of access to all of these different types of foods that we can eat to stay healthy. We realize that there are some people, however, even within the US, who live in what we call a food desert. And a food desert is simply a geographical area where it's difficult to come across these types of fresh fruits and vegetables because more than likely it's an economical situation, and the fresh fruits and vegetables are expensive. The longer a product stays on the shelf at the grocery store, generally the less expensive it is. And so some people simply just can't afford fresh fruits and vegetables. In that situation, a good alternative really are frozen fruits and vegetables. They often contain the same nutritional content as the things that you would actually find in the section. They might not taste as great, but because of the way we package our food today and pick it when it's not ripe so that it can get to the grocery store in 2 weeks and sit there for a while before it gets to our homes, the frozen food actually has, in many cases, the same nutritional content. The way you can eat foods that are the highest in nutrition are really the foods you grow yourself or that are picked right away and eaten, because when fruits and vegetables are ripe, and you pick and eat them, that's where they have the most nutritional content. So just something to keep in mind for those folks who maybe don't have access to fresh fruits and vegetables. So in closing, I just want to say, I hope that you can find just a couple of things that I've talked about today, a couple of small things that you can take away, whether it's keeping a food journal to understand what you're eating and maybe making a couple of modifications, small modifications, bringing in more fruits and vegetables, or finding a buddy to exercise with and share notes with during this pandemic to help boost both of your moods. But whatever you do, take a couple of tidbits of advice here, I hope, and apply them in your life so that you can stay happy and stay healthy.
Great information, Andrea. A couple of quick questions submitted, and then everything else we'll collect and try to answer those with a blog or something else in the near future. As far as when I'm trying to get, this is the question, when injured workers go back to work, they're getting ready for surgery. Are there things we can do to prepare our employees to be better prepared for that surgery and get back to work faster and healthier so that they have a full recovery?
Yeah, that's a great question. And actually at Sedgwick, we offer a program, we call it Surgery Nurse. And our nurses help educate people, just like you said, before and after surgery on some of the things that I mentioned in our presentation today, on foods that they can eat before and after surgery so that their bodies can be at optimal at an optimal point for them to undergo surgery. Another thing they talk about and educate on is mindfulness and relaxation techniques, because a lot of people, when they're getting ready to have surgery, have a lot of anxiety. They've never been through anesthesia before, or they have and they don't want to do it again. So we focus on being able to use our minds to control anxiety and pain, and we walk them through that process. So those are just a couple of the tips that our nurses are providing to injured workers as they get ready to undergo surgery.
And the other one deals with exercise. You hit upon, it doesn't all have to be at once, but the question is, I see a lot about cardio. I have a Fitbit, so cardio versus fat burn zone. Well, what's better? Is there a better, is that something you can give?
Sure. Well, it really depends on what you're trying to accomplish, right? So if you're trying to burn fat, then typically they say after you hit the 20-minute mark of intense workout, or getting your heart rate up, then that's where you're going to start to burn fat. But if you're talking about just being generally healthy, then it's an increase in activity. And I think, sometimes it helps to reframe how we define exercise, because a lot of people think it's got to be that 30 minutes. You got to get to that 30-minute point before you see an impact or any effect. But if we're talking about general health and increasing our heart rate and increasing our mood and those types of things that I talked about earlier on, it doesn't have to be past the 20-minute mark or 30-minute mark. It can be, for 10 minutes at a time, anything that's getting your heart rate up and sustaining it for a couple of minutes so that you can get those endorphins going and you can get that blood flowing. It really is about getting your heart rate up and getting the blood flowing. That's going to help protect your hippocampus and help you release the endorphins and reduce cortisol levels. Those are the types of things that are going to give you the physiological boost that we see that comes with exercise. So great question. It just really depends on what you're trying to achieve and what you can stick with, because that's the other thing with exercise. I mean, if you have great aspirations, I'm going to do this every day, but if it's too hard for you to maintain and you say, I simply don't have the time, well, who doesn't have the time to do 10 minutes on their lunch break? Most of us do, and we can find that time and we can slide it into our busy schedules and stick with it. And that's really the key.
Great. Thanks, Andrea. Appreciate it. Well, be sure and check out the Sedgwick RIMS virtual page and see our other sessions that are going on. And once again, Andrea, thanks for the great information on eating right and exercise.
Thank you.